I'm Dr. Vijay Deshmukh, founder of Smilex, practicing dental implant for last 30 years, and I am implant surgeon. In this video, you will come to know detail about All-on-4. All-on-4 today is very famous as a technique to give you fixed teeth within a very short period of time, and this has become very popular. But mid-90s, the founder of All-on-4 technique, Dr. Paulo Molo, I met him recently. Dr. Paulo Molo is out-of-box clinician doctor who has invented this particular technique of placing just 4 implants and giving the fixed teeth, and this has become very popular. Lately, last 15-20 years, this has become very popular, but when the technique was first launched in mid-90s, around 30 years before, it has really opposition, because as a traditionally we used to place 6 implants or 8 implants or sometimes 10 implants, and then we restore those cases. And here there was a simple solution where he advocated to place 2 tilted implants of 30 degree and then 2 straight implants, and then immediate solution can be given. So definitely the technique was not accepted quickly in the Europe, and then around 2003 or 5, many associations and societies has given the green signal to this technology, which has been useful to the thousands of senior citizens globally. So this All-on-4 technique, which has been really become popular, we are doing at Smilex for last 10 years, and very good results, around 98% success we deliver to our patients. So how this particular procedure is done, that is the video, and in this video I am going to explain to you the All-on-4 technique. So you are typically into late 40s, 50s or 60s or 70s, and you lost most of your grinders, and now you are not able to chew food. You are facing problem in chewing the food, and only the front few teeth are remaining because you are just brushing those and you are just compromising on chewing. And now you decided that you want to see an implant surgeon for All-on-4. So what we do at our center is we thoroughly first see your medical history, because most of the patient do have some medical problem. Most of the patient definitely also need a long discussion because also they have some emotional problem. So at Smilex, we thoroughly do the case history, clinical examination, long chat with the patient to understand the exact requirement of that patient. And then we go and take the 3D CBCT, and CBCT is thoroughly checked for the available bone, because All-on-4 is possible only when there are areas where we can place longer implants, only when there are areas where there is bone available. So typically front areas we need bone which is front to the maxillary sinus. This area need to have a good quality bone. If the quality of bone is not good, then definitely we don't suggest you to go for All-on-4 and immediate loading. If the quality is compromised, we many times do All-on-4 delayed, means we place the implant and then we wait for 3 months and then restore. What we call it All-on-4 delayed, which is little bifurcation. But generally All-on-4 is a technique which in most of the cases we can give immediate fixed teeth within 72 hours. So once we see the CBCT, we examine very carefully, very carefully the available bone quality, strength. Then our team member, there is a prosthodontist, he will also see the patient. Then there is a proper intraoral scan we do. Then we do the facial scan. Then we take intraoral photographs, extraoral photographs to decide what exactly is recommended in this patient, which is going to be the perfect. And then after the medical evaluation, once we get the fitness from your physician, if you are a senior citizen or if you are having 1 or 2 medical problems, it is safer to take a fitness from your doctor, who is your physician. And once that is done, then the appointment is given. So typically the appointment for 1 arch All-on-4 is longer. It takes around 45 minutes to sometimes 2 hours. Sometimes the case is straightforward, 45 minutes is good. Sometimes there are multiple bone defects, bone is deficient, grafting has to be done. Then we recommend to go for a 2 hour of long session with the patient. Generally, all the surgeries are done under local anesthesia at our center, but sometimes there are unusual patients also which we treat under general anesthesia also. So, patients has been taken to the OT, and under local anesthesia we give a small cut in the gums, we open the gums, and then with a proper 3D navigation we place the 4 implants. 4 implants are placed at the appropriate space to give us the strength required. Then the team member from the restorative team will come, and then they will evaluate, or I will only evaluate the strength of the implant. So it has been seen by 2 ways. First, we see the torque. So what is the torque? So minimum it has to be 50 or 60 Newton centimeter of torque, the primary strength, primary stability of the implant. And then we got digital devices called RFA devices, which gives us the ISQ, which gives the implant bone contact stability. What is the stability question? What that we get digitally chair side with the patient. Once we see everything is nice, cumulative, all the values are matching to the need of the patient, then the patient is gone for digital scan. And once the digital scan is done, the prosthodontist, the restorative dentist, they discuss with the laboratory, and the laboratory fabricates, and then immediately within 72 hours, sometimes 24 hours, depend from case to case, we fix the temporary PMMA prosthesis on the top of the implant. Then there is a list of things what patient can eat or what patient cannot be eating. But this is a very routine procedure at Smilex, and this is a very routine and established modality of treatment in the globe today. So if you are deciding to go for All-on-4, choose wisely a proper center of excellence. Like Smilex is a center of excellence for All-on-4 because the number of All-on-4 we do each year. So best of luck for your full mouth rehabilitation. I hope this video helped you in taking a decision to go for All-on-4. So thank you for watching this video. If you like and subscribe this video. Thank you.